Hi everyone, my name is Honey Patel, and today I'll be summarizing my paper on the 7 key issues shaping the U.S. healthcare system. The U.S. spends more on healthcare than any other nation, yet access, quality, and affordability remains a major problem. I'll be walking through the 7 main challenges from payment systems to workforce shortages and how they can connect to bigger issues of cost, access, and quality. The first issue is going to be free market versus social model. The big debate here is, should healthcare run like a business or a public good? The free market model focuses on competition and innovation. That's why the US leads in medical tech. But as Flood and Thomas state in 2018, markets don't work perfectly that when people are sick. Patients can't easily just shop around. Social models like in the UK and Canada ensure universal access and lower costs, but can face wait times and funding limits. The US is a mix private insurance plus programs like Medicare and Medicaid, which are social. The real challenge is balancing innovation and equity. Second issue I'm going to be talking about is price transparency. Most patients don't know what care will cost until they get the bill, which is a major issue. Recent laws in 2021 and 2022 require hospitals and insurers to post prices, but many aren't compliant or make the info impossible to read. If transparency were standardized and clear, it could help patients compare prices and shop smarter. But as of now, most people still rely on doctors, not data, to decide where to go. The fix could be stronger enforcement and simpler tools that show real out-of-pocket prices. The third issue is going to be fee-for-service payment. The US mostly pays doctors using fee-for-service, meaning they're paid per test, visit, or procedure. Sounds fair, but it rewards volume, not value. According to Bonenheimer and Pham, this drives overuse, duplication, and fragmented care. New models like bundled payments and accountable care organizations are trying to reward better outcomes instead of more services. The goal here could be move from how much we do to how well we do it. The fourth issue is going to be physician shortage. The AMC projects a shortage of up to 124,000 doctors by 2034, especially in primary care and rural areas. Reasons are aging population, rising chronic diseases, and limited residency slots due to capped GME funding. Plus, burnout has gotten worse since COVID 2019. The impact is longer wait times, fewer appointment options, and overworked providers. The solution here, we could expand GME funding, offer loan forgiveness for primary care, and give NPs and PAs more responsibility. Telehealth also helps fill rural gaps. My fifth issue I'm going to be talking about is single payer versus multi-payer. Another huge debate is one national insurer or many private ones. The single payer systems like Canada or Taiwan achieve lower admin costs and universal coverage. But they face underfunding and long wait times. The US multi-payer system offers more choice, but it's inefficient and drives inequality. A hybrid model like adding a public option may be a realistic middle ground, keeping choice while improving equity. The sixth issue I'm going to be talking about is centralized versus decentralized regulation. The US has decentralized system, power split between federal, state, and local levels. This causes major variation in access. For example, not all states expanded Medicaid under the ACA. Centralized systems like in the UK promote fairness through national standards but can be slower to innovate. The US will probably stay hybrid but needs alignment between federal and state policies to ensure consistency. The last issue I'm going to be talking about is lack of primary care. Primary care is the foundation of a strong health system, prevention, coordination, and chronic care, but only 1/3 of physicians go into primary care, and that number keeps dropping. Starfield, Shi, and Machiko found that countries with stronger primary care have better outcomes and lower mortality. Yet the US only spends 5 to 7% of total healthcare dollars on primary care, stated in 2014. The fixes could be better pay, loan incentives, telehealth expansion, and support for nurse practitioners in underserved areas. Wrapping this up, all 7 issues from payment systems to workforce gaps point back to the same 3 goals: cost, access, and quality. The US has incredible technology and resources, but without alignment across policy, regulation, and incentives, progress stalls. The path forward: shift from volume to value, strengthen primary care, improve price transparencies, and build policy consistency across states. The goal isn't just reform, it's to make care equitable, efficient, and sustainable for everyone. Thank you for listening.